State of Affairs. I'm Steve Adubato. We're coming to you from the Agnes Varus NJTV studio in Newark, New Jersey. It is our honor once again to introduce Assemblywoman Nancy Munoz, a Republican from Union County, are you not?
Yes, Union County, Summit, New Jersey.
Summit, the 21st Legislative District. A nurse by profession?
Yes.
Oh, the only one? In
Only licensed registered nurse.
Thank you for clarifying that.
Yeah.
You care about health care issues. We're going to get into that.
I do.
So one of the issues you're very involved in is the fact that you've introduced two pieces of legislation. You'll check this out on our website, A1711 and A1651. Two pieces of legislation creating a sexual assault victims Bill of Rights. Explain it.
Well, you know, obviously this is an important topic, and we've been discussing this a lot. I was on the ad hoc committee on domestic violence, and we did a lot of look into domestic violence, and this runs parallel to that, which is sexual assault. Obviously, we've been following the case at the hiring of in the state government.
Well, let's clarify for a second. The Assemblywoman was on the committee
Special investigator.
Listen, let's put it out there. The
yeah.
Katie Brennan case, you can read about it. You were there. You were asking questions. You were listening to testimony.
Right.
Did that influence what you're doing here?
No, no, it didn't. But it supported what we're doing, which is to make sure that everyone has equal access to therapy, to respect, to be believed, and by law enforcement, by the prosecutor's office, and by healthcare professionals. So what we found is that, you know, sometimes a victim will go to the police station and they're not believed. And we have 10,000 reported sexual assaults per year in the state of New Jersey. And what we heard in testimony from this particular person, Katie Brennan, was that the police didn't actually believe her.
Right.
And this Bill of Rights says that you have to be believed. I mean, and you have to be believed even if you don't report to the police. You need to be entitled to the same offer of services. Just because you don't go to the police doesn't mean you shouldn't have a rape kit done, or you can't get counseling services. You can't be offered a professional, an offer to get some kind of therapy. Because, you know, people don't understand that trauma affects people differently. People expect that everyone reacts differently. Why do people cry at funerals or laugh at funerals? People expect you to cry.
Different reactions.
Different reactions and delayed reactions.
So what does the legislation do? Does it change what?
It changes that it simply states that every victim must be treated with respect. And that's what it says. And so we need to educate law enforcement. That's part of the process. And we've done that with domestic violence legislation. We need to do that to say, police officers, when you report, you need to believe that victim, whether it's a female, male, and not say, yeah, right, it didn't happen, or it was your fault. We want to make sure that they don't say to the victim, did you, you know, where were you? Why was it, did it happen at 3 o'clock in the morning? Were you drunk? Regardless of what the reason is, they have to be believed and therefore offered services.
We're talking to Assemblywoman Nancy Munoz, who is engaged in a very aggressive effort to change some of the laws in our state regarding victims of sexual abuse. Jackie, help me on this again. Jackie wants us, and she's right, to talk about the confidentiality piece of this. Talk about it.
The confidentiality piece extends, we have it now for victims of domestic violence, the address confidentiality, so that the person who's looking for you can't find you. So you get to have a confidential address, usually a post office, and then the post office will send that mail to your address. And it keeps you, it allows you some privacy. Right. We've extended this to victims of sexual assault, to victims of stalking, and even people who are looking for a restraining order. I had a constituent who was being stalked, and the person found out where she had moved to by going into her parents' mailbox. Now this includes sexual assault as well as stalking and restraining orders.
Before I leave this topic, Nancy, where are we right now with this? Is it moving through the legislature?
They're both moving through the legislature.
Do you have any word from Governor Murphy as to where he is on this?
I have not, but I haven't heard, but I can't imagine that he wouldn't sign this. It's a common sense piece of legislation that makes sense, protects victims, which is what we all want to do in the state of New Jersey.
Let's shift gears. We're talking with Nancy Munoz, State Representative, 21st District. Let's try this. You have a medical background as a licensed nurse. Can we talk about end-of-life issues as we speak right now?
Yes.
Actually, Assemblyman John Bersicelli will be joining us on State of Affairs. He's a sponsor of legislation. For 7 years, he's been fighting for, some people call it physician-assisted suicide, but it is, in fact, an effort with someone with 6 months to live to get the assistance of a physician to help them die.
Yes.
Your late husband, who was one of our family's closest friends, Dr. Eric Munoz.
Yes.
he and millions of other physicians
Work to save lives.
there's an oath to save lives.
Right.
Is there an inherent, somehow a contradiction in this, in your mind?
Yes, in my mind there is, and I voted no on the bill.
So it passed both houses of the legislature.
Yes.
As we speak,
Yes.
on the 8th of April.
April.
The 9th, I apologize. The governor he said we think he supports it, we don't know. If it gets passed into law, what would it mean for millions of physicians?
Well, you know, as you also know that I have a son
That's right.
in healthcare, and
Right.
I spoke to him about this, and he said, well, that's fine, but I'm not doing it. So I do know that they do it in other states, and there are physicians who will agree to do this. I have many concerns. One of my concerns is that the people who, in my view, as my career in healthcare, that could most benefit from this, people with ALS maybe, who are or somebody with dementia who just doesn't want to go on. You have to be able to self-administer the drug.
Yes.
And you also have to be mentally competent to make the determination. And we have done a great deal of work in palliative care, in hospice care, in making our patients comfortable and determining the end of their lives, what we can give them to make them comfortable, whether it's, it's palliative care, anti-anxiety, pain medications, effective pain medications, and allow the patient to die at home. This bill requires the prescription to be written and the patient to bring it home and self-administer. Now, you bring a lethal dose of a drug home, who's to say that somebody else doesn't accidentally take the drug? That's one of the worries.
So
but
the
my worry
safeguards
is
you're looking for?
The safeguards, but I'm also looking for expansion of palliative care. You know, we are really...
2 seconds left, go ahead.
We're looking to make people comfortable to end their lives in the way that they want to end them, but I want to do it that is consistent with our oath as healthcare providers to do no harm and to make people comfortable and allow them to die at home.
A few seconds. The POLST, P-O-L-S-T, stands for?
Practitioner Order for Life-Sustaining Treatment. It allows a person to determine in their own words how they want the end-of-life treatment to go. My mother has one at my house. It says, I don't want chest compressions, I don't want to be intubated. If I go into failure, you can give me Lasix or don't give me Lasix. You determine. Practitioner Order, because not only physicians, but advanced practice nurses and PAs can sign the form.
You've been listening to State Assemblywoman Nancy Munoz from the 21st Legislative District. I want to thank you for joining us on State of Affairs.
Thank you so much.
Come back anytime.
I
Stay
appreciate
right
it. Thank you.
I'm Steve Adubato. This is State of Affairs, and we will be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of State of Affairs with Steve Adubato has been provided by Keystone Mountain Lakes Regional Council of Carpenters, the law firm of Gibbons, P.C., the Turl Fund, supporting Right from the Start NJ, New Jersey Sharing Network, International Union of Operating Engineers, Local 825, Choose New Jersey, Seton Hall University, and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State, and by Employers Association of New Jersey.